Okay, so dumping syndrome is one of those things that is not very pleasant, but the good news is it's largely treated by changes in diet, being able to predict when it happens, and knowing that most of the time it doesn't require anything more than changing or modifying when you eat and exactly what you eat. So that's all good news. What is dumping syndrome? It's a condition that can occur after weight loss surgery, whether it's a sleeve or a bypass, but particularly after gastric bypass. And it's caused by the rapid emptying of undigested food from the stomach into the small intestine. The incidence of dumping varies, but it occurs in about half of patients that have a gastric bypass and about 1 in 5 that have a gastric sleeve. So you don't hear about it too much after a sleeve, but it definitely can happen. There are two types of dumping syndrome: early dumping or late dumping. So early dumping typically occurs within half an hour to 2 hours after you eat food. What'll happen is you might feel you get abdominal cramps, diarrhea, nausea, and you might actually vomit. Late dumping is 2 to 3 hours after that meal. You might feel dizzy, sweaty, you may have a rapid heart rate, you might feel like you're going to pass out, and some people actually do pass out. So it is something to be aware of. It's caused by the rapid emptying of undigested food from the stomach into the small intestine, which causes a rapid influx of sugar directly into your bloodstream. That's what gives you the symptoms of dumping syndrome. The reason we talk about the amount of sugar in the food is because of the risk of dumping syndrome, because it's a direct cause of dumping syndrome. So to treat it, you might want to have smaller meals, more frequent meals, and avoid trigger foods. So particularly simple carbohydrates, instead having more complex carbs on a smaller and more frequent basis. Secondly, there are some medications that can slow stomach emptying, but oftentimes we don't need that to reduce your symptoms. If you are feeling like you're getting symptoms of dumping, particularly after a gastric bypass, it's well worth talking to your surgeon, your dietitian, or your GP about how we can help with that.